Greetings, I'm Dr. Ha-In-sik. Today I'm going to talk about relation between digital technology and dentistry. When we talk about innovative products and companies, there's a book that is always being mentioned. This is a book by Jeffrey Moore called Crossing the Chasm. And there's a very famous image in this book. It is this. When innovators make a very innovative product, early adopters exclaim with joy with the launch of such product they have been looking for. Moving past the early adopters, these products need to be accepted by early majority for their practicality and versatility. However, in most cases, they fail in this process. This is called a chasm. In between early adopters and early majority, there exists a chasm. One of the notable examples is electric cars. Electric cars were developed first 100 years ago. It took about 100 years for the market to accept electric cars. What is the cause of such chasm? There are three reasons. First is the functional aspect. At the very least, one should have been able to ride the car from Seoul to Busan, but in the early days, this was not possible. It took 100 years to satisfy such requirements. Second was finance. Even if electric cars showed good function, if it was too expensive compared with existing gasoline cars, people would not buy it. Third is social aspect. Worldwide, we're experiencing extreme weather problems, and this has led to many catastrophes. Due to environmental issues, people feel more inclined towards using electric cars. Now let's talk about digital dentistry. Where are we currently? This is the same with digital dentistry. There was significant chasm between early adopter and early majority. However, as of recent, such chasm has been overcome mostly, and now we have moved on to early majority phase. Why did this occur? First, in functional aspect, the clinical performance has improved and it shows outstanding performance compared to analog ways. Second, in terms of financial aspect, the cost is much more acceptable. Third, in terms of environment, by using digital equipments, we can reduce a lot of waste when we provide dental treatment. In terms of environment, we are very becoming eco-friendly. In practical terms, I would like to talk about what we can do using digital dentistry. Digital dentistry can be divided into 6 categories. First is guide surgery for placing implants. When you place implants using guides, you can place it in a very accurate position. Therefore, we can avoid situations where the form of final prosthesis is unfavorable due to implant placed in the wrong position. Second is the prosthodontics. In the past, analog ways were used to make crown and bridge. By using scanner and milling machine, you can provide very aesthetic and accurate prosthesis. Third, restorative dentistry also utilizes digital equipments.
이러한 디지털 장비를 적극적으로 활용할 수 있게 됐다는 건데요. 이 면에 있어서는
One-day practice has become a reality, and this is a very significant feat indeed.
네 번째는
Fourth is denture. Using digital dentistry, temporary denture can be provided, and therefore the number of visits and the time spent within the dental clinic is significantly reduced. Therefore, clinical efficiency is drastically improved.
매우 임상의 효율성을 증가시킬 수 있다라는 그런 측면이 있고요.
As of late, final denture also utilizes digital dentistry.
상황입니다. 다섯 번째는
Fifth is the orthodontics. Using scan, patient's oral cavity is scanned, and using that, bracket positioning, fabrication of devices, wire bending can be all done using digital dentistry rather than relying on the manual work done by the dentist.
디지털화할 수 있기 때문에 매우
This leads to very accurate procedures. The accuracy of surgery can be drastically improved in the orthodontic area as well if we use these digital technologies.
향상시킬 수 있다라는 겁니다.
Practically speaking,
실질적으로 우리가 디지털 덴티스트
what we do using digital dentistry will be discussed.
우리가
What needs to be done using digital dentistry is determined by two factors. The first is the human resources we have in our dental clinic.
자원이고요. 그 인적 자원에는 누가
The first question is for prosthesis, who makes the design and does the lab work.
다가오고 있고요. 두 번째는
Second is financial issue.
병원에서
How much are you willing to spend in terms of hardware and software renewals?
유한 애뉴얼 피를 어느 정도 수준까지 감당할 수 있는지를
Within that context, you need to determine the scope of digital dentistry you'll be practicing.
생각을 해야 된다는 거죠. 따라서 우리가
You need to choose and focus on key strategies. What will be the priority? You need to think about this.
그래서 내가 무엇을 하고 무엇을 외주를 줄 것인가라는
You need to understand what you're going to do and what you're going to outsource to prevent unnecessary costs.
위원에 방지할 수가 있다는 겁니다. 따라서
You need to accurately understand what kind of clinical practice you provide at your dental clinic.
정확하게 우리가 알아야 되고요. 두 번째
Second,
이 금액
you need to have an understanding how much return you're going to make with the investment. First, you need to understand what kind of treatment you provide primarily. Is it prosthodontics, implant treatment, or orthodontic?
아니면
You need to think of this. Second,
에 대해서 생각을 해야 되고요. 두 번째로
you need to think about how much use you're going to get out of the equipments you're going to buy. This should be considered when you buy devices and softwares and pay for annual fees.
꼼꼼히 따져보셔서 거의 매일 하는 그런 프랙티스라고 한다면 원내에서
If the device or tools that you're going to buy is related to the treatment that you provide constantly, then it's better to buy them. But if you only do it once or twice a year, rather than doing it yourself, I think it is better to outsource it.
때 우리가 실질적으로 대부분의 개원이가
I think this should be the key for most private practitioners.
맞춰야 한다고 생각을 하는데요.
Let's think of scanner.
해서 임플란트
Most dentists provide implant treatment,
두 번째가
guide surgery, prosthodontics. Third is restorative dentistry. I think we need to focus on these three treatment areas.
그렇다고 한다면
In this sense, if we adopt digital dentistry at our dental clinic, what kind of changes will there be in the treatment environment?
한번 말씀을 드리고자 합니다.
First,
첫째는
you can get predictable treatment.
가능해집니다. 우리가 임플란트를 심을
When we placed implants in the past,
망을 열고
we would open flap and place implant based on the surgeon's experience. However,
조물이 올라가는
at times, implants are placed slightly deviated away from the ideal position. In this case, in prognosis stage, there can be many problems. On the other hand, if you use guide and use the top-down method, using digital dentistry, the final prosthesis position is almost the same. Therefore, you can get a very predictive treatment.
매우 예측 가능한 탑다운의 보철 치료를 완성할 수 있다는 그런 장점이 있습니다. 또 한 가지로
Also, things that were once deemed impossible can now be realized. This is a situation in my dental clinic. 3 patients are all prosthodontic patients. The dental clinic has limited human resources and there's only 1 dentist and there are 3 chairs. It is almost impossible to provide prosthodontic treatment for all 3 patients because perhaps impression may have come out wrong for a patient. In this case, delay would occur. Treatment schedule can go completely awry. Unpredictable results may occur if impression taking continues to fail. However, if you use digital dentistry for scanning, these can be prevented ahead. This is another example. If the clinical crown is long, you may think you have done prep a lot. However, in a lot of cases, there is undercut. If you look from the buccal side, there may be undercut in the lingual, and on the lingual side, you can see undercut on the buccal side. But if you use digital scanner, you can check undercut immediately. Therefore, we can prevent situations where the patient comes in repeatedly to rectify the situation. In the analog days, what was impossible, some have become possible with the digital dentistry. For example, the patient may have orthodontic appliances on, like brackets and wires. At times, when you need to do inlay, you would have to remove all the appliances and block out the bracket. However, you can do prep and just leave the wire and do the scanning. You do not need to remove these appliances physically. Second, when we take impression in patients with bad perio conditions, due to multiple undercut, the impression material can get stuck and it can cause a lot of trouble for the patient. In this case, when you use scanner, the patient is freed from such pain. On the day of extraction, cord is placed, the scanning is done after a week. Within that period, design is made, prosthesis is made, and this can be delivered within a week. This is possible using digital technology. I would like to summarize my lecture. In the beginning, I talked about Crossing the Chasm by Geoffrey Moore. The book talks about how innovative technology, in order to move on from early adapters to early majority, it needs to overcome a chasm. Chasm for digital dentistry. There can be many. Technical hurdles in digital dentistry has been overcome, and the cost effectiveness has already surpassed analog dentistry. Third, the intent of the operator, be it dentist, a surgeon, or lab technician, it can be fully expressed, more accurately so than the analog ways. This is now possible with digital dentistry. There is a movie called Fried Green Tomato. There is a very famous line in the movie. There are moments where we face change in our lives. In such moments, most people feel fear. However, what we need to actually fear is regret that we should have changed at that moment. Ladies and gentlemen, I believe digital dentistry has overcome such multiple chasms and has moved on to early majority stage. If you're still wondering whether you need to do digital dentistry or not, I believe this is not the moment for you to consider, but to actually make an action.
선택은
The choice is ultimately up to you. Thank you for watching.